Now, she was a really compliant patient who wore her elastics. What do you do if you have a patient who just isn't compliant with her elastics? Now, fortunately, we're treating primarily adults who wanted this treatment themselves, are paying for it themselves, so they're going to be more compliant. But you're going to have some that still won't be compliant. So we have a nice non-compliance technique called the piggyback archwire that we use with these open bite cases. This is the piggyback archwire. What you do is you place a segmental archwire, in the bracket slots from lateral to lateral. I like that to be a rectangular archwire. And then what you do is you place a round archwire through the molars, the bicuspids, the canines, and then you set that up on top of the incisor brackets. And then I usually tie a little segment of ligature tie between the two wires just to make sure they don't slip. What this is going to do is it's going to use shape memory in a slightly different way so it can help push those anterior teeth further down. So here it is in schematic side view. Again, segmental wire, sectional wire from lateral to lateral. I want that to be rectangular. Okay, so like a 1622 is fine. And then through the posterior and canine brackets, and then up over the incisors, I want a round nickel titanium. Usually you're in an 018. It is a good size to choose. And what that's going to do is it's going to help drive the incisors down, closing the open bite even further. Now, for every action, there's an equal and opposite reaction. So as those incisors push down, the canine wants to shoot up. If you can get the patient to wear a triangular elastic from the canine to the lower canine and first bicuspid, it's just going to help keep that canine down and give you more net anterior incisor extrusion, closing your open bite. Obviously, they haven't been compliant. That's why you're doing this. They probably won't be compliant with that. But if they will, hey, it's worth a shot. It's only going to turn out better. So here's how we would place it. Again, a sectional archwire lateral to lateral. You want that to be rectangular. And then you're going to have a round nickel titanium through the posterior brackets and the canine bracket, and then sitting up over top of the incisors, and then just tie a little segment of ligature wire between the two, just so they don't slip off each other. It's going to, again, reuse or use shape memory of nickel titanium in a slightly different way. That wire is going to push down on the incisors. Great way for non-compliant patients. Again, add in that triangular elastics. If the patient will wear it, it'll just make it work better because it's going to keep that canine from wanting to shoot up, which is going to eat up some of your incisor extrusion that you want. These work really, really well. Okay, so here's a case where we did that. Okay, and you can see not even 3 weeks later how much those anterior teeth have extruded, closing the open bite. Now, I hadn't quite figured out the triangular elastic part, so you can see how the canine intruded just a bit. Now I'd have the patient wear a triangular elastic as well. Now, the one disadvantage of the piggyback archwire is when you're done, your bracket slots aren't going to be lined up. So you have two options. You can reposition the brackets so that they're now, again, even with your canines, which is the slow way to do it. Or you can place a step-down bend, which is the easy, fast way to do it. You need a steel wire that will accept bends. You cannot do this on nickel titanium. Nickel titanium will not accept bends. And if you do bend it, it's a very temporary bend that will not retain its crispness. So you can use a step bend plier, which is very easy to use. You just squeeze your hand like that. You've made a step bend, and you can go ahead and place these little step bends. Okay, so it's going to place a little, just a 1 millimeter step bend. Now that's going to maintain what you got from your piggyback. And then if you can get the patient to wear elastics, if there's still some more, it'll just get them the rest of the way. So you just mark where you want to make the step bend, and then you squeeze the step bend plier. It's going to put that 1 millimeter bend. Then you mark the other side, and again you squeeze the plier to put your other millimeter step bend. They have all different sizes of these pliers. I just get the millimeter. It works great. If you needed more for some reason, you can put two bends together. Now you got 2 millimeters. Saved you buying a plier. So there's what it looks like. Just that little 1 millimeter step. It's going to help maintain what you got with your piggyback archwire. That's what the plier looks like in side view, what it does to the wire, and we'll show a video as well. Again, just clamp it, and it's going to make a nice crisp bend. You want to really clamp firmly so you get a nice crisp bend, not some anemic bend. And then here's the video. And you want to come in at 90 degrees. This is for, actually, I'm going to show you how we can intrude or extrude a tooth. But we make these step bends for these piggyback arch wires. Now you have the one side. Now you're going to go and make the other bend. And look how firmly I squeeze. You want to squeeze as firmly as you can to get a nice, crisp bend. If you don't squeeze hard enough, you'll get a very anemic bend that will not be nearly as effective. Here's another clinical example of the piggyback arch wire. What I usually do is I give the patient 2 chances with elastics. If they don't wear them, then we go ahead and place the piggyback arch wire. And then remember to follow up the piggyback arch wire with your step down arch wire in steel arch wire. You have to use steel when you're bending wire. You cannot use nickel titanium.
To make sure you don't miss any of our Powerprox pointers, please subscribe at 6monthbraces.com/orthotips. To learn more about our live seminars for Powerprox 6-month braces, please visit 6monthbraces.com/live-seminars. To learn more about our unlimited case support and online seminars, please visit 6monthbraces.com/online-seminars. If you prefer to call us, our phone number is 440-646-1000. To learn more about our laboratory services for Powerprox 6-month braces, which include digital bracket placement, 3D printed indirect bracket bonding trays, digital case setups and treatment simulation images so you and your patients can both see the case results before you even start, IPR guides so you know the exact amount and location of any IPR that you may need, and a lot more, please visit 6monthbraces.com/Powerprox Lab.